Hello everyone. Let us see the case of a 45-year-old man named Aniruddha from Mumbai. Let us hear his story. Aniruddha, a 45-year-old man, was a construction worker who lived in Mumbai. He led a very active lifestyle, enjoying hiking, mountaineering, and playing basketball in his free time. In February 2023, he was involved in a severe workplace accident, resulting in the traumatic amputation of his right leg above the knee. He underwent surgery and a prolonged hospital stay to recover from that injury after his leg was cut off. During the first few weeks of surgery or after that, Aniruddha focused on physical rehabilitation. He learned to use his one leg and received support from his family and friends. Despite the physical challenges, despite one leg being cut off, Aniruddha remained optimistic and determined to regain his mobility. About a month after the amputation, he began experiencing unusual sensations in his missing leg. Initially, he felt mild tingling and itching, which he attributed to the healing process. However, these sensations soon intensified and evolved into severe pain. He described the pain as sharp, stabbing, and throbbing, sometimes feeling as if his foot was being crushed or twisted. This had a great psychological impact on Aniruddha. He did not understand what was going on with him. His leg was cut off from above the knee, and yet he could feel as if his leg was paining. He could feel his leg, which was not in existence. The phantom limb pain took a significant toll on Aniruddha's mental health. He felt frustrated and helpless as the pain was constant and unrelenting. His sleep was disrupted, leading to fatigue and irritability. He also experienced anxiety and depression, fearing that the pain would never go away and that he would never be able to return to his normal life. He sought help from his primary care physician, who referred him to a pain specialist. After a thorough examination and discussion of his symptoms, Aniruddha was diagnosed with phantom limb syndrome. The pain specialist explained that the sensations were due to the brain's continued interpretation of signals from the nerves that once connected to the amputated limb. Let us understand more about this phantom limb syndrome and what it exactly is. Phantom limb syndrome is a condition in which individuals experience sensations, often painful, in a limb that has been amputated. These sensations can include tingling, cramping, heat, cold, and even the feeling that the phantom limb is moving. The syndrome can occur in people who are born without a limb also, or lose a limb in an accident. What are the causes of phantom limb syndrome? The exact cause of phantom limb syndrome is not fully understood, but several theories have been proposed. The neurological theories state that when a limb is amputated, the nerve endings at the site of the amputation continue to send signals to the brain. The brain interprets these signals as coming from the missing limb. Brain reorganization is another cause. The brain has a map of the body in the sensory and motor cortices. After an amputation, the areas of the brain responsible for the amputated limb may get taken over by nearby regions because of neuroplasticity, but the original map remains intact, causing the sensation of the limb still being there, even though the limb is not there anymore. There are psychological factors which are also involved. Emotional and psychological factors like stress and anxiety can influence the perception of phantom limb sensations. The most common and often most distressing symptom of phantom limb can be pain. Pain can be sharp, stabbing, or throbbing. Feelings of tingling, cramping, heat, or cold may also be there. Some individuals feel that their phantom limb can move even though it is not physically present. Phantom limb syndrome is primarily diagnosed based on the patient's history and description of symptoms. There are no specific tests for it, but doctors may perform physical examinations and imaging studies to rule out any other causes of pain. How to treat this symptom? There is no cure for phantom limb syndrome, but several treatments can help manage the symptoms. First is medications. Pain relievers, antidepressants, anticonvulsants, and muscle relaxants can be prescribed to alleviate pain. Mirror therapy can also help. This involves using a mirror to create the illusion that the amputated limb is still present, which can help reduce pain and improve mobility. Electrical impulses can also be sent through the electrodes placed on the skin to help reduce pain. Acupuncture can also be very helpful. Some individuals find relief through acupuncture treatments. Psychological therapies like cognitive behavioral therapy, biofeedback, and other forms of psychological support can help manage the emotional aspects of phantom limb pain. In severe cases, surgical procedures like nerve blocks or neuromodulation may also be considered. The prognosis for individuals with phantom limb syndrome varies. Some people may experience a reduction in symptoms over time, while others may have persistent pain. Effective management often involves a combination of treatments tailored to the individual's specific symptoms and needs. Ongoing research is focused on understanding the underlying mechanisms of phantom limb syndrome and developing more effective treatments. Advances in neuroimaging and neurostimulation techniques hold promise for better management of this condition in the future. Thank you so much for listening.